Hello again. I'm kind of interested in physical activity and its effect on dementia because a number of studies that I've quoted in the past have shown that doing a more consistent physical activity helps to keep the memory intact or cognitive functionability intact. In fact, a number of studies have shown that those people who have done the exercise over a period of time have been helped with improvement in their hippocampal volume. I mean, the hippocampus is the area where the memory seems to be stimulated. And subsequently, it looks like that the anti-inflammatory markers, the mitochondrial dysfunction, and degenerative neuro disorders decrease when somebody is engaged in a physical activity. So certainly, number of more studies have come out. For example, there was a study that showed that VO2 max, maximum oxygen consumption, as the oxygen consumption that you can achieve as maximum level of exercise decreases, then the dementia increases. So if somebody who has low VO2, if he tries to do exercise and achieves or improves his VO2, his dementia risk decreases. So there is no question that we have a problem with dementia when we have sedentary lifestyle. And as we also know, the obesity causes secretions of certain inflammatory markers, and that causes people to have higher risk of blood pressure, diabetes, circulatory issues, as well as dementia. We have 35.6 million people who have dementia, and it is estimated that by 2030, we'll have 75.6 million people who have dementia. So I am keen on suggesting, like I did it in one of the previous videos, that take the steps for preventing the dementia. So I was kind of surprised when I came across a study that showed that not all physical activity is same. And this kind of surprised me. We talk about exercise, and I know I've talked about high intensity intermittent training, to simple walking, which is a brisk walk, to weights and stretching or flexibility and all that sorts of stuff. And these constitute important contribution to reducing the inflammation, and inflammation seems to cause problem with the neurodegenerative disorders. So it is important that we exercise, and we exercise consistently. And one of the facts that came across to me, which was surprised, that when the hippocampal volumes were measured by scans, when you consistently do the exercise, the hippocampal volume improves. So in an average person, it reduces by 1 to 2% after a certain age, while in people who develop dementia and who have been not doing, or whose maximum oxygen consumption, or VO2 max, is reduced, it decreases the volume by 3 to 5%. So in totally different study, which kind of threw me off completely, was that people who are engaged in a labor activity, like people who are manual laborers, we would automatically assume that these people are engaged in a significant physical activity, and so their risk of dementia should be less. Interestingly enough, the people that were doing repetitive arm or leg movement, or who were doing walking or going upstairs or climbing, stooping down, for the laborious work 8 to 10 hours a day, they had a higher incidence of dementia and cognitive function, almost 15.5% compared to a low activity level, which was only 9%. So this study was done between 2017 to 2019. And there were more than 7,000 people in this particular study. It was done in Norway. And the physical activity was divided between a 1 to 5 level. So very low impact physical activity compared to very high strenuous physical activity was 5. And when they compared these people that were engaged in laborious activity, whether it is a construction, welding, or unloading, loading trucks. So basically, there was a substantial physical activity. These people had a higher incidence than people who did exercise as a recreational exercise or exercise because they wanted to do exercise. I am not sure there was a clear-cut explanation after the study as to why the people that actually did a lot of laborious activity had less benefit from the physical activity, and people who did 5 days a week or 7 days a week activities that was purely for the purpose of exercise had a benefit from it. I have some thoughts about it, but it is unfortunate that segment of our population which is constantly involved in physical activity, in constructions and lumber yards and delivering trucks and loading and unloading warehouse work, actually don't get benefit from that physical activity. One of the thought was that a continuous activity, a continuous working of the muscles, may be producing some inflammatory markers. Contrast to that, when you do a 20 minutes of a treadmill or 30 minutes of walking, it is entirely different. It probably reduces the production of anti-inflammation. Rather, it produces the anti-inflammatory markers. So I think we are looking at two different reasons. The other possibility that I thought was that the socioeconomic level, educational level, may be associated smoking, drinking, drugs. I don't know if this population was matched for those things, because we certainly know that the cigarette smoking is harmful for circulation, and it causes increased incidence of strokes and heart attack and kidney dysfunction, as well as circulation in the legs. So I don't know whether these people were matched for their, or adjusted for their smoking history, or maybe excessive alcohol use, or maybe even drug use. So it is difficult to know what exactly was the cause. The other possibility is that the socioeconomic, the educational level of somebody, if it is low to start with because they had a lower intelligence or lower learning ability, as an outcome, we may have some difficulty with cognitive function in the later life because they didn't start with a higher level. Again, these are all my personal opinions. The study does not say that, and I really truly don't know what exactly caused it. But the takeaway from both these different groups of studies, doing a physical exercise on a regular basis as an exercise does help in reducing inflammation. Inflammatory markers increase the risk of dementia, increase the risk of mitochondrial dysfunction, increase the risk of neurodegenerative disorder. So when you reduce the inflammation, it certainly helps to prevent dementia, improve the cognitive function. There was the one rough mention was people that took ibuprofen on a regular basis, on a daily basis, had some decreased incidence of dementia. Again, I would not advise that, but at least it is interesting to note that. So we will have more studies coming out and reasoning as to why certain things happen, but certainly one should engage in regular exercise every day for prevention of dementia. Thank you for watching. If you like it, please subscribe. Thank you. Have a nice day.